Welcome back to the Fresh Screens podcast, where we highlight entrepreneurs and leaders who are setting fresh standards in their industries. This is episode 3, and today we're joined by Davis Bradley, the owner of Uncommon Physical Therapy in Charlotte, North Carolina. Davis launched Uncommon PT in March 2023 when he previously managed and owned a practice that was voted best physical therapy practice 3 years running. His clinic specializes in outpatient orthopedic physical therapy and is built around continuity of care, hands-on treatment, and rejecting the assembly line model. Uncommon PT has quickly built a 5-star reputation with patients, consistently praising its uncommon customer service and expertise. We'll dive into Davis's journey, his vision for growth, and what sets Uncommon apart. But first, a quick message from our sponsors.
Thank you, Miles. And we're excited to have our first sponsor of the podcast today. And it's brought to you by Citrico AI. Citrico are helping private health clinics improve patient engagement, reducing no-shows and streamlining scheduling, allowing teams to spend less time on monotonous admin work that takes them away from what matters most, their patients. To learn more, visit citricoai.com or drop a comment in the comment section below. Now, let's dive into today's episode. Davis, great to have you on, mate. I wonder if you could just begin by explaining your inspiration for founding Uncommon Physical Therapy and what uncommon standards mean to you personally.
Yeah, so Uncommon Physical Therapy started in my mind a long time ago with one of my previous mentors, and it was just the way that we approached patient care, if you will. Nothing actually to do with the physical therapy aspect of it, right? More as we've all been a part of a service industry experience where you have a great experience and you go, wow, that draws me back to this place, regardless of what that experience is, right? At the letter of the law, we're in the service industry, right? We're here to take care of people, provide a service for them. If we can do that and make it as enjoyable of an experience as possible, that's first rate for us. And it just happens that most of the time when people are coming to us, they aren't feeling great, right? We're not in an industry where it's just like, hey, I'm going to get my nails done. We're in an industry where somebody's coming because they generally don't feel well. So there's this little or overwhelming kind of experience with healthcare at times where people just don't feel taken care of. And so that's where Uncommon started. It started with how do we almost change the model of the healthcare experience and shift it to the taking care of the person and then provide the best service that we can, which for us, that service is the physical therapy aspect of it. And so, to your question, Charlie, where did the kind of term uncommon come about? It's not that we're doing wildly weird, interesting, off the cuff stuff. We're just doing the standard things that you would expect out of someone at a really, really high level, and trying to do it at a really, really high level every time, over and over, again and again, which then makes it uncommon. So when you have a patient who sees you in January and you get them better, and then they see you again in November, that standard's still the same, and they go, wow, there's nothing that's been changed about this process or these people. Their level is uncommon, if you will.
It's interesting because there's like a transponders with sports that they always say just do the basics well and you'll be better than 90% of the people, right? It's like in basketball, just pass first, point guards, that kind of thing. Do the basics, share the ball. It really sets you apart. And it's interesting, we've had a similar conversation where they're looking for ways to really set apart from the competition as well. And one of the ways they said about doing it is like, even if somebody comes in, they recognize that maybe the problem they're facing is outside of their comfort specialist zone, they're still doing their best and try and point them in the right direction, give them any advice that can help them. And yeah, it really makes a difference to the patient experience.
I mean, our little tagline is to be successful, we must do common things with uncommon standards, right? It doesn't have to be, you don't have to reinvent the wheel sometimes. Something as simple as for us is like if a patient's appointment is at 9 a.m., we get them started at 9 a.m., right? Which sounds so simple and so easy to wrap your head around, but how many times have we all been to the doctor where we go, oh, our patient's at 9 a.m. and I was sitting there at 10:30 waiting to get taken back, and that's just frustrating and that's annoying. So like the little things of, hey, we're gonna I'm gonna have my admin give you a call tomorrow. and they actually call them tomorrow because that's what they're supposed to do, and they hear from them. And so, it's the common things, it's the easy things that don't take skill, that don't require extra effort, but you just do them well over and over and over, makes the difference for the patient. And then you provide them the exceptional physical therapy care, and it's just a match made in heaven.
Yeah.
Yep.
I mean, to sum that up, it's how you do one thing is how you do everything, right? Just because something's easy
Exactly.
doesn't mean it shouldn't require the same
Yep.
amount of attention as something that's
Yep.
difficult.
We kind of have a rule where, like, I'm in a small office that's myself and two other therapists and our admin up front. And when we have patients in the waiting room, we kind of have to walk past them to get to the treatment area to use the restroom. We just say hey to everybody, whether they're our patient or not. It's a really simple thing. It's a common courtesy to do to somebody. Hey, how you doing? I hope you have a good Tuesday. Cassie will be with you in a second. Justin will come grab you in a minute. And they kind of look up and they go, oh, I've never met you before, but that was nice. That was pleasant, right? And you already start off their experience with something, again, they're not here because they feel good, but you start off their experience with something pleasant, something uncommon, if you will, where most of the time it's just bland and unenjoyable to be in these sort of settings.
So that dovetails perfectly, right? Your reviews rave about the patient-centered, hands-on experience. So how do you ensure, above what we've just spoken about then, that every single therapist delivers that consistently high experience to your patients?
Yeah, so that comes down to, you have to start with the right people, right? Again, in an office like mine, where we're not trying to just churn and burn patients and see as many as possible, our growth is going to be restricted to finding the right therapists. And when I say right therapists, it starts with the person. It doesn't necessarily start with the PT skills. We all graduate with the same degree. We all have the ability to learn skills. We all have the ability to grow and become great therapists. But you have to find the people who share the same passion for the therapy or the uncommonness of care that you do, right? And that doesn't necessarily mean that everyone has to be outgoing and be a super vibrant people person, but they have to be willing to put the patient first above everything else, right? Of, hey, you know what? I've got to walk downstairs and meet Miss Jones in her car just so she can hold on to my arm because it's a rainy day. And you know what? I might get rained on a little bit, but I'm going to do that because Miss Jones needs a little help getting in. That person is not a great PT. That person is a great person,
Yeah,
right? And so that's how it starts. And then it's really, for me, after you find those people, it's really simple because they do it without asking. That's just, it's part of their DNA. And they expect you to do the same thing, right? I don't have to lead them in doing that. Probably most of the time, I'm actually following them in doing that and going, hey, I could probably be better at doing this. I could go a little bit more out of my way to make this person's experience better, because my other therapists are just those type of people, and my admin are those type of people that kind of just lead forward in that sense.
It's really admirable. And to be fair, I think it touches on the point that, you can have the best business in the world, but if you hire one wrong person, it can bring everyone's level down. So how does that change your interview process? How do you come to learn about somebody and develop that relationship with somebody to the point where you can recognize those qualities instantly above the specialization?
So there's two things that I say that I try and do. I say that I'm always interviewing, regardless if we have a need or not, because if you find a great person, they'll create the need, right? So if you find a great person who's going to be a great therapist, whether your schedule dictates it or not, they will fill the schedule themselves, right? They'll attract patients. They'll treat somebody, and that person will go, well, I was at dinner with my friend and she's going somewhere else and she's having a terrible experience. She needs to come see you, Miles, because you guys are just exceptional. So you're always just looking for the right people and bring them on regardless. And then when you're interviewing them, you have to just be really thorough and be really honest as to who you are and what you're looking for, and make sure that that matches what they're looking for. I tell everybody that This is a little bit like a marriage, right? A job interview is not Davis is just trying to find someone. I'm also trying to find and be the right fit for you. And the way that we approach things might not be the best for everybody, right? Somebody might just want to churn and burn through patients, which is fine, and not spend a ton of time with them because they have trouble making the small talk or doing those little things. Um, so we interview on the phone. We bring people in the office, have them hang out with us, see our process, see how we interact with things, have a couple interactions back and forth, sort of thing, and then kind of go from there. And you can really tell pretty quickly whether the person fits into what we're trying to do or not. And then you talk about the PT stuff, which I think is surprising when I talk to a lot of potential employees is I don't ask PT questions because we all, like I said, we all pass the same test.
It's
We all
actually
have
prerequisite to even be there and talk to you, isn't it?
right. So we get into that stuff much later in the interview process. And that is more of like, hey, do you generally have a passion for this setting? Right? We're in the outpatient orthopedic setting. If they generally have a passion for the outpatient orthopedic setting, they're open to learning that sort of stuff, and they have the right qualities of everything else, then it kind of fits. But you have to have the qualities of everything else before we even get to the PT stuff. You could be the best PT in the world and not meet the other standards, and you wouldn't make it with us.
Brilliant. Surrounding your patients with great people who are also
Great.
great therapists, right?
Yeah. Yep. It sounds so simple when you say it. Um, but like I said, I'd rather have a room full of A+ people who are 80% the best therapists in town because our patients will get significantly better results than have A+ therapists who are 50% the best people because it just isn't going to work.
Maybe if I'm wrong, but a patient's going to remember the tangible difference between therapist A and therapist B is probably going to be smaller than the actual personality qualities, right? That's going to keep them coming back. So actually, hiring based on that is going to make you stand out more.
That's what
Even in
that's
my
what I
own
believe.
life, yeah, even in my own life, I've got memorable physical therapists that I've worked with, and it's not because of the treatment they gave me; it's because of the interactions that we had during our sessions together.
Yep. So you're going to get better patient buy-in, you're going to get better patient attendance to appointments, you're going to get all of that sort of stuff. And again, if you can get all all of PT when it comes down to it is consistency of doing the things that somebody asks you to do. So again, if someone's asking you to do 80% of the best stuff and you do it consistently over time because you've built a great relationship with a great person, you're going to get better than if someone asks you to do 100% the perfect protocol. Don't get you don't have that feeling or that bond with them, and so you don't do the things they ask you to do, you're not going to get better regardless that it's the best treatment. Now we try to provide both, right? We obviously try to provide the best treatment, but I'll take the best person who wants to be a great PT over a great PT who's just a okay person.
So you're speaking about how you deal with clients or patients. Sorry, the world's changed a lot, right, in the last 6 to 7 years, and I was wondering how has your patient expectations or care delivery models changed, especially post COVID? Are you doing online sessions? How are you coping with that?
So we don't do online sessions. Honestly, post COVID for us, there's been two interesting things that have happened in a positive way. People's general flexibility of their schedule has improved, where work is more understanding of, hey, I'm going to get my work done, but I'm going to be gone from 3 to 4, right?
Mm.
And so patients' ability to schedule appointments during our working hours has just been easier. And then post COVID too, I think people have just generally taken a bigger care for their own health and are having a higher expectation of what that care looks like. So then when they have an experience that they don't find fruitful, they don't just say, this is what it is. They go, hey, you know what? Maybe I'm going to look elsewhere. This really didn't feel right. I feel like there's something better out there. And we feel like we're that better out there, right? We've had way more patients now who said, "Hey, I've tried to go to PT and I went somewhere else, and you know what? It just didn't work for me. And then I heard about you guys, or I saw something online, or my doctor referred me to you, and I found you. And this is really what I was hoping that it was going to be." So people, feel like our parents' age, they used to kind of just go, "This is it," and they just dealt with whatever that was, right? I feel like now, post COVID, and with a little bit of the younger generation, it's more, I'm going to find what works best for me before just accepting that the norm is the norm.
And how do you leverage that patient advocacy? You touched on it multiple ways, doctor referrals, seeing stuff online, but is there any specific ways that you leverage that advocacy you've got from your patients to grow your business with referrals, etc.?
Yeah. So, again, we're a small shop, so it doesn't take a ton for us to fill up, but you have to be willing, if you think you're providing a really, really good service, you have to be willing to be unabashful about it. And when we have a patient who's had a really good experience and we know that they're returning to their doctor, we'll simply say, we'll say, "Hey, Charlie, I'm glad that your shoulder's feeling so much better. When you go back and see Dr. Wood, if you wouldn't mind just telling him that you had a really good experience with us at Uncommon, that would really help us." Right. And having your patients become your advocates for you is the best thing in the world, because, Dr. Wood has probably had 15 patients who've come back and he said, "Hey, how's PT?" And they go, "It's okay. It's fine," right? Or if Charlie comes back and he goes, "Oh my gosh, you sent the referral and they called me the next day, and then I was seen 2 days later, and my therapist spent an hour with me, and they really helped me diagnose what was going on with my shoulder, and they broke it down, and I really understood it, and I've been going to them consistently for 4 weeks, and you know what? I have to tell you, I think I'm almost done. My shoulder feels great. I had a really, you should send everybody there." The doctor is going to take note of that, right? And that's how we've built some of these relationships that we have around town, just by being really honest as to what we try and provide, how we provide it, and then asking our patients to be advocates for us. And they're almost always willing to do it, um, because when you create that bond with somebody that we're able to do, because the amount of time that we spend with them, they want to see you do well, right? They want to see you succeed. So
They're invested in you and they want to help you. I like that.
And is that community presence helping you grow and head in the right direction?
yeah, absolutely. So we've been officially open since January of 2024, and so not even 2 years yet. And we're hopefully gonna add a fourth therapist here in the next couple months. And so, for me, it's one of those of, we'll grow as needed without ever letting the quality of care diminish. But there's been just this steady little chug a chug chug along of the train, adding a little bit, adding a little bit, adding a little bit, which has been great.
What challenges do you face as you scale?
Knowing the right time to pull the trigger on those sorts of decisions, right? The financial aspect of adding another person and just what that costs. I'd say that's the timing of things is probably the biggest challenge. For us, again, I'll interview 10 people and not offer anybody a job. So that could be a challenge, right? Of trying to scale the time of when you need someone based on the numbers that the office is doing and finding the right person. But again, if that's the complaint, that's a great problem to have, right? And what'll happen is, my perception is what'll happen is, over time, the longer we're around, those great people who happen to be therapists around town will actually start coming to us and saying, "Hey, let me know when you guys need help. Sounds what you're doing is awesome."
Monopolize the industry in the local area. I can see it.
I mean, take the best people from around town and give them the best job and have them do work that they love with the best patients. Doesn't sound like too bad of a deal.
Absolutely. So that really brings me to the next question that I want to ask, the kind of magic one question. So a lot of clinic owners we speak to say there's always one nagging challenge, whether it's systems, hiring, marketing, scaling without losing quality. That's something you've just spoken about. So if you had a magic wand and you could fix one thing in the business right now that's either holding you back or slowing you down, what would that be?
I think the one thing that I would fix in the business is to be able to just shout from the rooftops to anyone who needs PT about what their expectation of what their treatment should be, right? Their expectation of that their treatment should be significant time spent with the provider, detailed interaction as to why you're doing what you're doing, and prognosis of what that should look like, right? I think that's probably my biggest frustration in all of it. You know, insurance is a pain in the butt, but that is what it is. All that sort of stuff. But it really breaks your heart when you hear someone who says, I didn't realize that therapy could be like this, right? And so just sharing that general knowledge of, hey, whether you go to me, whether you're in another city, whether you go to somebody else, your therapy should look like this because this is the best practice. This is how your experience should be. This is what's going to get you better. This is going to give physical therapy the good name that we think we deserve. That would be what I would say. I mean, the reality is in any business, there's good and there's bad. We're not the exception. There's great physical therapists and great offices that aren't mine, and there's physical therapists and physical therapy offices that are just subpar to what we should be. And we all have the same degree and we all have the same license. Um, and sometimes people don't know the difference unless they've experienced both of them. And so that's what I would really say is just, you know, how do we get that message out of there's if you're not really happy with the way something is going, it's probably because you're not where you should be.
And it sounds like you've been thinking about that for a while. Have you tried anything already to try
Yeah,
and
I
get that
mean,
message out?
yeah, that's kind of our general message as far as my office. You know, you don't want to ruffle too many feathers when you're in a new area like we are in Charlotte, being relatively new. But the longer that we're around and setting and keeping that really high standard that we keep, I think the more that question will come up, the more again, it's an interesting world where this little community of, you know, I don't know if you guys have this game in UK community of telephone where somebody tells somebody something and then they tell somebody something and then they tell somebody something and then they tell somebody something. That happens and that happens pretty quickly. You know, within a 5 or 10 mile radius of the office. And so, you know, we've been here almost 2 years. When we were here 4 years, think about how many more people we've touched and how we've already just changed that standard of what it will be around our little, 20 square miles around our office. I think we're doing it without um, overtly coming off and putting a billboard on the side of the highway.
So I mean, on that note, if you had any advice to give to clinical owners who are doing a similar thing to you and want to avoid the assembly line approach, what would it be?
Yep. My 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 advice would be you've got to be really disciplined. You've got to be really firm in your beliefs, and you've got to know where you're willing to concede on things and where you're not willing to concede on things. And then you've got to just keep doing it. One of my favorite kind of thought processes is, you know, everybody talks about short term, mid term, long term goals. How you get to each of them is just by putting one foot in front of the other over and over and over and over again. And that's how you get there. And so you've just got to be really consistent with doing it. You've got to be willing to push through some of the toughness, and you've got to be willing to accept that even when things are good, it doesn't mean that you're done. So That's usually when the most of the work can be done.
Every success leads to new hurdles, doesn't it? I think that advice summed up perfectly, and that wasn't just for clinic owners, that's business in general.
Yep. You can't get too fat and happy.
Until you're older, then we can get fat.
Exactly. Yeah.
Awesome. Well, Davis, thank you so much for your time today. It's been fascinating speaking to you.
Yeah, guys. Thank you, Miles. Thank you, Charlie.
Cheers, Davis. Thank you.
Absolutely.